Well, October is Breast Cancer Awareness Month, and all this month we are talking about breast cancer with a variety of experts. Well, joining us this morning is Dr. Leah Dietrich from the Center for Breast Care at Gundersen Health System. Good morning, Dr. Dietrich.
Good morning.
Well, first we'd like to talk about breast cancer rates this morning, but before we do, I just wanted to ask you about how your work center sees the money that's raised during the Steppin Out in Pink event that we have every year.
Yeah, I see that money being used a lot of different ways in the breast center and the cancer center. Just to name a few, it helps support local breast cancer research. It has funded some 3D mammogram units and provides free mammograms for patients who are uninsured or can't afford mammograms, and also provides some comfort items for patients who are undergoing treatment.
Okay. And the breast cancer rates that you're seeing, are they going up, going down, and why is that?
So unfortunately, in the last decade, we have seen that breast cancer rates are increasing, and they're increasing more quickly among younger women. This is happening mainly in early stage breast cancer that is estrogen receptor positive, which is the most common type of breast cancer that we see. Some reasons for this are felt to be the increasing rates of obesity that we see in the population and decreasing rates of fertility.
So these breast cancer rates, I know they're increasing in young women, but we're having more success in beating it, aren't we?
Yeah, that's exactly right. So I think it is also important to talk about the mortality rate. So mortality rate is risk of dying related to breast cancer. That has been decreasing. And so we are making good headway in treating breast cancer. If you look back over the decades since 1989, we've decreased the risk of dying related to breast cancer by 44%. So that means that over 500,000 fewer women have died related to breast cancer over that time period. And this is felt to be due to increasingly effective treatments and early detection through screening.
So it sounds like our future actually looks pretty promising in the breast cancer in general.
Yes, absolutely. Not only are treatments more effective, but we're also working on making treatments more tolerable. We are having many new tools to be able to identify patients who need more intense treatment and those who don't. So we're able to tailor our treatments to the individual. And that means fewer side effects and less treatments with the same good outcomes.
Okay, Dr. Dietrich, I really appreciate you joining us this morning. Thank you so much for being here.
Thanks for having me.